We turn now to another big story, that of the return of one of two Americans suffering from the Ebola virus to the United States from Africa. Yesterday, Dr. Kent Brantley, a physician from Fort Worth, Texas, who was in Liberia when he contracted the disease, came to the United States. He was wearing a protective suit, and he actually walked from the ambulance to the hospital when he arrived at Emory University Hospital in Atlanta. So far, 729 people have died, and over 1,300 have been infected in what is now the largest outbreak of Ebola in history. The outbreak is centered in the West African nations of Liberia, Sierra Leone, and Guinea, and U.S. officials have urged Americans not to travel to the region. A second American health worker infected with Ebola, Nancy Wrightbull, is also expected to return to the U.S. for treatment in the next few days. Dr. Tom Frieden is the director of the Centers for Disease Control. He is in Atlanta this morning. What can you tell us about Dr. Brantley's condition this morning?
Well, it's encouraging that he seems to be improving. That's really important, and we're hoping he'll continue to improve. But Ebola is such a scary disease because it's so deadly. The plain fact is we can stop it. We can stop it from spreading in hospitals, and we can stop it in Africa, where is really the source of the epidemic and where we're surging our response so that we can control it there.
But we saw Dr. Brantley in that protective suit walk out of the ambulance. So is it likely he will survive?
I can't predict the future for individual patients. We'll follow that closely. But what we do know is that we know how to stop Ebola. It's not easy, but it can be done even in Africa. In fact, we have stopped every previous outbreak, and I'm confident we can stop this one, but it's going to be hard because it's spread through so many countries, and there's such a risk of further spread in Africa.
Can I ask you about Dr. Brantley's wife and his two children? They also visited him in Liberia. I understand they're on a 21-day fever watch. Any chance that they contracted Ebola?
Well, the fact is that when patients are exposed to Ebola but not sick, they cannot infect others. So it doesn't spread casually, and it doesn't spread from someone who's not sick. And our understanding is that they did not have contact with him when he was sick. So it doesn't appear that they would be at risk. But that type of activity, contact tracing, finding people exposed to Ebola and tracking them for 21 days, and if they develop fever, making sure they're isolated and finding their contacts, that's core public health action. And that's how you stop Ebola.
Are you absolutely convinced that Ebola will not spread here in the United States?
We know that there are travelers from places where there's Ebola. We know it's possible that someone will come in. If they go to a hospital and that hospital doesn't recognize it's Ebola, there could be additional cases, or their family members could have cases. That's all possible. But I don't think it's in the cards that we would have widespread Ebola in this country, because the way it spreads in Africa is really two things. First, in hospitals where there isn't infection control, and second, in burial practices where people are touching the bodies of people who have died from Ebola. So it's not going to spread widely in the U.S. Could we have another person here? Could we have a case or two? Not impossible. We say in medicine, never say never. But we know how to stop it here. But to really protect ourselves, the single most important thing we can do is stop it at the source in Africa. That's going to protect them and protect us.
Ebola has killed 729 people, yet according to the World Health Organization, seasonal influenza kills 250,000 to 500,000 people per year. The flu, are we overreacting?
Well, Ebola is a deadly disease, and because it's so deadly, we have to take it seriously. It can be devastating. It can destroy not just the confidence in healthcare, but have huge social and economic impacts on society. In parts of Africa where we've dealt with Ebola for years, we're now much better able to control it. We find the cases quickly, we stop them quickly, we prevent the practices that may allow it to spread. That's what we will eventually be able to do here. The sooner we do it, the fewer people will die from it.
The CDC is in charge of making sure that Ebola does not spread here in the U.S., and yet just this year we've heard examples of the CDC mishandling anthrax, smallpox, avian flu samples. Are you absolutely confident that the CDC will make sure this virus is handled properly and will not be spread?
There were lapses in our laboratory. Fortunately, we identified them and reported them before anyone got harmed and before there was any release of anything into the community. But that really shows the importance of being meticulous with infection control. We're doing that in our labs now. We're working around the clock to make them among the safest in the world. They're already among the best in the world. But it really shows that for healthcare workers taking care of people with Ebola or other infectious diseases, it's important to be completely meticulous with infection control. Ebola is not one of the most infectious diseases, but because it's so deadly, the stakes are so high that healthcare workers need to have a healthy fear of what could happen and turn that fear into action to make sure they take scrupulous action, that every single infection control precaution that we recommend is followed.
I know this is a busy time for you, Dr. Tom Frieden. Thank you for joining us this morning.
Thank you very much.